All right, this is Dr. Cole with Mid Atlantic Chiropractic. I have my lovely assistant, Miss Gloria, here today. But again, it's going to be more of that up and over motion. She does have some muscle soreness because she's been doing her exercises. What we'll do is I'll take you through a full adjustment. I'm going to verbalize what I'm doing here today. All the way out. And the best way to start would be if Miss Gloria could go on her belly for me. Typically, one of the things that we always take a look at is going to be the leg length. Now, based off of Gloria's last x-rays, her leg length should be pretty even, which it is. One thing I've been doing more recently is I'll do a small tug, seeing how well the femoral acetabular joints are moving. Doing a little bit of distraction also provides some relief. And when taking a palpation here, one thing that we can notice is Miss Gloria's piriformis on the right side is pretty tight, as well as on the left. And would you agree? Mm-hmm. Okay.
I think right is slightly worse.
Yes, and so because of that, one of the things I do is this long axis distraction, and I've been incorporating this with all my patients recently. And really what's interesting is when I'm doing this distraction, a lot of times patients will tell me that they feel it most where they're having the issue. And so a lot of times if it's an SI joint issue, they'll feel the pressure there. If it's a lumbar or a low back issue, they'll feel it in the low back mostly, even though I'm contacting all the way down on the calf and up on the shoulder. What we're going to do for Gloria today is we're going to use counter nutation. So I'm going to have her take a big deep breath in. She's going to hold that deep breath, and we're going to slowly exhale. Good. So we're using the diaphragm to slowly traction out those discs. She's going to take another big deep breath and exhale. Good. And one more time, big deep breath. Hold and exhale. Excellent. So one of the things that we do when we're doing counter nutation is that we're actually bringing the sacrum down. And so if you think about L5 sits like this, your sacrum ideally is going to sit somewhat at this angle, usually between 30 and 40 degrees. If someone has a higher angle, say up into the 50s or upper 40s, our job is to help bring that sacrum down and hopefully open up that L5-S1 disc space. When I palpate there, is that tender at all?
Yes.
Okay, so we're going to do 2 straight down on the top of the sacrum here. So deep breath, all the way out. Good. This one you don't need to breathe for. And then we're going to do 2 gliding motions coming up. Good. And you'll see that I'm using a pinch grip here. The reason I do that is I'm actually contacting the lamina pedicle junction, and I don't want to be pushing directly on that spinous. Now, when I take a look at Gloria's x-rays, we do know that she has some rotation in L1, 2, and 3. We do need to rotate these to the left. Again, you're going to see that I'm using a pinch grip, but I'm actually going to be using more pressure on my thumb to help rotate that lamina as well as the TP off to the left. So big deep breath here, all the way out. Good. And the reason I use a support hand here is I'm actually applying a little bit of pressure on top of my thumb to make sure we have a good P to A drive here. It's a big deep breath, all the way out. Good. And one more time, big deep breath, all the way out. Good. One of the most common places for people to get locked up is anytime there's a junction. So thoracolumbar junction is one of the big ones. We'll do 3 drops P to A here. Good. So right now, all I'm doing is I'm feeling how her ribs are articulating. Usually she has a couple pokey spots, which we did find, especially on this right side. So I'm going to have her go on her back now. What we're going to do is A to P, or anterior to posterior, flexion, thoracic adjustment. So what I'm going to have you do is interlock your fingers, place them behind the neck. Elbows will come in together. I would like you to tuck your chin for me. We're going to come on up. Big deep breath here, all the way out. Good. And again. All the way out. And one more. All the way out. Good job. When palpating Miss Gloria's neck here, one of the things I tend to notice is she does have a rotation of C2. And when I push in there, is that tender?
Yeah, it's spicy.
Okay. So right side more than the left?
Yeah, slightly.
Another thing is we need to put some extension down through C5 and C6. So what we're going to do is a supine diversified here. So we're going to come up and over, contacting that C2. One of the things you'll see me do is we're going to laterally flex in a small amount of rotation. going to be coming up and over. I'm going to have you relax that right shoulder, wiggle the toes. Good. And then set and hold. So one of the big things that not a lot of people notice is when we have just one click, it's because we're being very specific and trying to adjust just one bone. And so when it comes to C5, it's a little bit harder to just get one, so it might be a little bit louder of a cavitation. But we're going to do some extension here. Extension is slightly different with our line of drive, but again, it's going to be more of that up and over motion. Good. And then lastly, what we have to do is a little bit of distraction here. Help calm everything down and open up those disc spaces. All right, so Miss Gloria should be feeling pretty good now. We just adjusted her whole spine from top to bottom, and hopefully she agrees with me. Fantastic. So another adjustment from Mid Atlantic Chiropractic. Again, I'm Dr. Cole. Thank you, Miss Gloria, and Sean behind the camera. Have a great day.